Big data is a term that describes particularly large data sets, mostly dealing with human behavior, that can be analyzed to reveal patterns, trends, and other associations. What makes big data big is when the datasets are too large or complex to be processed using traditional methods. But it's not only the scale and complexity of the data that defines the technology. Where big data shines is in the relationships between different datasets. These relationships can reveal trends and behaviors that can only be seen at such a large scale. My research looks into how this technology fits into the world of government. The U.S. government is largely considered to be the foremost data authority in terms of both quality and quantity of the data it collects and publishes. This data has the potential to influence markets and shape national conversations. In 2009, the government launched data.gov, which serves as a central repository for previously inaccessible federal government data. Today, nearly 200,000 datasets from over 180 government organizations have been published and are currently curated on the site. Hundreds of companies have been built around the use of this data. Other such open data initiatives have given way to whole industries such as the GPS, and it was estimated that open data's economic potential could be over $3 trillion worldwide. Michigan has implemented big data using a centralized database system, which has led to the state government saving over $1 million per business day, all while improving the services it provides to its citizens. Medicaid is one such program that has seen vast improvements using this new system, leading to better patient care and easier administration of medical records. Michigan has been able to track health trends across the state and has reached out to specific communities to improve quality of life across the board. However, they still have a ways to go in terms of crisis management. In Flint, many people have experienced lead poisoning from the water. This problem is indicative of a lot of issues in Michigan, including failures in the political system, as well as failure in the infrastructure. This crisis really highlights the limitations of big data technologies. While big data was used to assess the risk people faced and plan resource allocation, it did not solve the problem. The FDA has created a central repository for health data across the nation, which is used for monitoring the safety of various medical products it oversees. While the system is robust and has great potential, it has only led to a handful of safety actions. Many have suggested using the system for research purposes, which would allow third parties access to the data. This has raised many concerns of privacy, including questions of HIPAA violations. The FDA has been successful elsewhere, though. They have used big data to effectively model both drug resistance and adverse drug reaction sequencing. Each of these cases represents a different aspect of government where big data is currently being used and how it impacts the world around it.